Now that we know our case summary and the event that happened, we have a full picture, we can use a fishbone diagram to help us identify the actual root cause of the problem, which in our case is unsafe practice when using lines and hanging fluids. We can look at multiple factors, including the people, the process, equipment, environment, as well as materials, to help us understand what led to the adverse event. Many problems are multifactorial, so looking at all possible causes and how they connect and intertwine can give us a very full picture of the situation. So when we think about people, in regards to this case, we're thinking about the nurse who hung the fluids. We want to think about, how was she when she was performing this task? Was she stressed out? Was she feeling rushed because she had a pile of other tasks waiting for her? We want to think about how she was specifically when she was performing this task. We also want to think about our environment. So the NICU is a very high stress and fast-paced environment, like we talked about earlier. Sometimes it's calm, but sometimes it can be very chaotic. So we want to ask ourselves questions like, was her pod mate trying to chat with her while she was doing this critical task? Was there a code happening or an admission happening in her pod that she was distracted by? We also want to consider the process. So at the time, it was common practice to hang the new fluid but leave the old bag on the pole until you had a minute later at the end of your shift to walk it over to soiled utility. We're also going to consider the materials that we were using. So we think about the new bag that was set in the pump and the old bag that was still connected to the patient but wasn't in the pump. Now we have tubing that automatically clamps when you pull it out of the Alaris pump. But if in this case the tubing did have those automatic clamps, maybe it would have engaged and it wouldn't have been free flowing into the patient. So we want to think about that. We also want to think about our equipment. So our Alaris IV pump, the IV tubing, the venous access. In this case, the Alaris pump was set properly. It was running at the correct rate. It was just running tubing that wasn't connected to the patient, which is not a mechanical failure. It's a human error.